agency, in the patients that you serve. Really, today we are going to kind of show you how our services can help empower your teams when you connect with patients with these supportive services. So you as a home health patient, when you draft up your start of care, you feel good about the start of care plan. Then a few weeks later, they may be back in the hospital and you think to yourself, what happened? Clinically, your team did everything right. So what are some of the things that you could have done to maybe mitigate that admission to a hospital? So today we're going to go ahead and walk through the gap, and more importantly, what can we within the healthcare industry do about it, and what can your team do in tandem with us to make sure that your patient stays safely at home with the supportive care that they need. So we are mindful of the fact that your home health team, you guys are juggling a lot. You're managing complex diagnoses from complex patients with diagnoses that range in complexity. You're coordinating discharges once they complete their plan of treatment. You're trying to hit your outcome metrics. You're revisiting these outcomes in your QAPI period, and all of that while making sure that your team is executing quality customer service, supporting families, supporting patients. It's a lot to balance. So the issue that we know of is that it's not a lack of effort from you. It's really what happens in between your clinical visits that really makes an impact. So how do we extend your care beyond your visits without stretching your team any further? That really kind of comes down to what Medi-Cal has now made available throughout the state through your Medi-Cal managed care plan. And it's at no cost to the patient. Libertana has been around for over 30 years. We've been focusing on patients within the home. So we're also one of the larger providers within the Medi-Cal landscape, and we work pretty closely with all the major healthcare plans. More importantly, we do understand that with us, we're not trying to step into your role. What we can focus on today is how we can work in tandem with you and your team to support your care plans. So when your nurse leaves, when your PTs or your therapist leaves, there's still someone from our end that can help support the patient with follow through. So again, I'll go back here. Really, where we can provide an impact with your organization is helping you improve your patient outcomes, reducing your readmissions, strengthening your star ratings, and daily reinforcement that patients need that sometimes you observe but have no control over. So the challenge within our industry, you have patients that you probably can think of where you worry between your clinical visits who don't get connected to care services quickly enough. Sometimes your complex patients that you're probably thinking about now get stuck in these referral loops, or have home environments that aren't set up for recovery or success within the home health starter care plan that you've drafted. So everything may look fine once they get home, but sometimes reality inevitably hits. The family members who support the patient maybe don't live within the home, or maybe work full time. Maybe the home layout is unsafe. Maybe the patient doesn't feel safe moving around in their own home. So you and your clinical team, you can only do so much. Sometimes even maybe some things such as maybe the patient that you serve under home health, they skip their meals, they don't move around as much, they may forget some medications or don't have access to medically tailored meals or adequate meal prep. And before you know it, the patient that you've been working so hard on a clinical level is starting to decline again. So this is the gap that we are talking about. So what are some of the limitations that you guys sometimes encounter? Recovery doesn't just rely on skilled care. It really depends on consistency. Consistency can be hard when there's no caregiver on site, or maybe the primary caregiver is overwhelmed, or there just isn't enough support hours. So we often hear that home health patients will tap into in-home supportive services, IHSS, and it's not enough. So even if your team is given perfect instructions, all of these looped together isn't sufficient enough. If there isn't someone to reinforce it with adequate hours or support. So that's when you and your team may start to think of, or may start to see for your more complex patients, falls with medications, loss of mobility, loss of confidence, not because the plan of care was inadequate, but because there just wasn't enough support to sustain it. So outcomes can suffer really with limited ADL support. Sometimes on your end, we imagine that you encounter insufficient authorization for social worker visits, restricting access to necessary supports. Maybe caregiver availability issues, something that you encounter with your patient. And ultimately, some misconceptions. Many believe caregiving is only for private pay or in-home supportive services. Us as an agency, we have a contract for CalAIM, so those who do have a Medi-Cal managed care plan within Los Angeles County can access this free in-home caregiving support, whether that's, again, home care or respite. So what is CalAIM? CalAIM is at a high level, an umbrella of services. It's an initiative made by Medi-Cal that recognizes that health outcomes isn't just driven by nursing care alone. It's driven by social supports that all contribute to a patient's wellness and their ability to stay at home safely. So Medi-Cal wanted to include supportive services that include or target things like daily living, caregiver support, safe transitions home, or sustainability at home, which is a big shift from how things used to work overall, or in commonplace within the healthcare industry that we are now mitigating to resolve. CalAIM, so kind of consider, your more complex patients, your complex many patients, and think of CalAIM as your solution or potential solution to your more vulnerable populations that you serve. So basically, how it's relevant to you is that really with CalAIM, patients have additional support, help with everyday tasks, reinforcement with routines, someone making sure that they're safe and following the plan of care that your team has drafted. When that happens, you can see more stabilization within the patients that you serve because of the support that our care team executes for your patient, which means that they feel more confident, and you start to see fewer breakdowns, fewer hospitalizations between your clinical visits for home health. So an overview of some CalAIM offerings. In general, these are just kind of our core services. We provide enhanced care management where they get a personalized social worker, assisted living facility transitions. But the one essentially that you as an organization would get the most value from is respite and home care services to supplement those IHSS hours or to provide relief for primary caregivers for your more vulnerable patients. So ultimately, personal care services, think of it as, again, we're not intervening with your clinical care. We are working in tandem with you and your care team, which means that within your PT visits, your skilled nursing facility visits, the client gets caregiving reinforcement, which is so critical. So you may have heard of these terms, and basically all fall under the home care umbrella, and they're kind of defined differently, but kind of think of this as home care. Personal care services, we refer to within the CalAIM landscape as helping assist with activities of daily living, instrumental ID or IADLs, and really with those, the caregiver can help mitigate, especially those who have mobility issues. And lastly, in order to tap into personal care services, eligibility criteria. So in order to tap into personal care services, one must have a Medi-Cal managed care plan, and really kind of think of those who face functional deficits and face a limited social or limited support systems. Respite is another pillar or another service that falls under the home care umbrella. Uh, with respite, one can receive about 336 hours per year, which kind of tacks on top of their IHSS hours that they currently receive. And again, in order to qualify, you need a Medi-Cal managed care plan. And those who really tap into services, respite services specifically, it's for those who have primary caregivers who need a break, who maybe are experiencing burnout, like primary caregiver who is maybe going out on vacation. Those are instances that we've seen quite a bit. And again, it all falls under the home care umbrella. But yeah, the CalAIM has created this benefit that we execute to prevent caregiver burnout. Sometimes with cases where you've seen caregiver burnout, the patients do end up going into a hospital, not unlike, your home health patients that may have trouble remaining independent at home, where they do experience hospitalizations from time to time. So that's where respite and home care services under the CalAIM umbrella poses a real great value. So what is the proven impact of these CalAIM home care services? We have seen a 60% lower hospitalization risk, those who do receive this service. We've seen a significant drop in how many times they get rehospitalized. Second, we've seen home health agencies who have tapped into this service actually increase their quality outcome scores and their star ratings because patients are able to execute stronger self-care, mobility, abilities because of the service and the consistency that it does provide. Improved patient satisfaction. We've seen agencies who tap into home care services through CalAIM increase their patient satisfaction as well. And lastly, the last impact is providing services. Within the industry, people, especially with regionals that are being capped or seeing budgetary limitations, really in need to supplement IHSS hours. So think of your patients who do receive IHSS and you're thinking, you know what, that may not be enough. Is there a way to access more? Sometimes regional center can't allocate more. This is where CalAIM can fit in. We can supplement those IHSS hours and it's at no cost to the patient. So what are the Medi-Cal managed care plans that we take on? So think of your Medi-Medi patients. If the Medi-Cal component of your Medi-Cal patient, of your Medi-Medi patients has Anthem, HealthNet, LA Care, Blue Shield Promise, or Molina, those are all patients that we can take on for home care services. We ultimately, if you have a patient that you want to refer, we'll verify and request for authorization. And we'll go ahead and get started. And obviously, we'll work with your care team to let you know where we're at in the authorization process and where we're at in the staffing process. So your team is made aware and can take that into consideration with your care plans. So why do home health agencies partner with us to utilize this CalAIM service? It benefits your agency, also with value-based care. It also improves your reimbursement. It improves your star rating, and it actually reduces the burnout or burden that's on your clinical staff and the home health agency. And it's at zero cost to your agency and really zero cost to the patient. So if you have any patients, again, who are on Medi-Medi and IHSS isn't enough or they need to tap into IHSS, those are all patients that we can take on. And the best way to know that is reach out to your social workers if you have that authorization tied to that home health patient. Reach out to your social workers, ask them, is there anyone that you sense that is at risk or could benefit from a consistent caregiver? And I went through a process where we go through the referral, authorization verification, and the start of services. So the key takeaways for you and your team. CalAIM home care helps your team's impact, your team's clinical impact. We kind of stay behind the scenes. We work in tandem with you, but you, as a clinical team, can do what you guys do best as we help support the care plans that you've put in place. Another key takeaway is that tapping into the service can actually improve your outcomes and your reimbursements and rehospitalization. Your ability to prevent rehospitalizations is such a big part of that. And caregiving, something that needs to be dispelled within our industry over and over is that home care isn't always private pay. It doesn't always come at a cost. For Medi-Cal patients, a lot of them don't know that they can tap into the service. And those who do tap into that service have really seen a huge improvement in their quality of life, have seen a reduction in the costs that come with the care that you provide. And again, free. And that's something that the Medi-Cal industry or Medi-Cal organizations aren't good at promoting. But yes, this is something that is completely free to your organization and the patient. And if you have a patient in mind, or you want to talk about patients in general, or how CalAIM can help serve your the community that you serve, this is our contact information. You can hit us up at info@libertana.com. This is all our website, and this is also our phone number. Kirsten and I will also go ahead and put our contact information in the chat, just in case you want to reach out to us directly. But just understand that, today we really went into the home care aspect of our services. And in future webinars, we will also showcase other pillars of care, which include assisted living facility transitions and comprehensive case management. But ultimately, with the home care side, I know there's a lot of things that need to be dispelled within the industry. So yes, Dr. Kami, I'll definitely share the slide deck with you. But ultimately, demystifying the cost of home care. I hope we kind of achieved that today, because this being a free benefit is such a huge opportunity for your patients to tap into where they can improve their quality of life. I'll go ahead and just open up the mics just in case anyone has any questions. One moment. I know I see some things popping up in the chat, but feel free to take yourself off if you have any questions that you'd like to pose to the group. And Gary, I hope I'm saying your name correctly. You got your email address. We'll go ahead and make sure that we get that slide deck over to you. How long does it take to process this? I would say if you refer a patient to our organization today, we'll go ahead and confirm within 24 to 48 hours that we received the request, and we're screening for eligibility, really screening for the Medi-Cal managed care plan if they are eligible for services. And I've seen cases get staffed within about a week or 2 weeks. One thing that we do take into account is there a primary caregiver that the patient has already identified, or do we need a staff for the patient? So that also does kind of contribute to how long it takes, but we've seen the best cases take about a week or 2. For the caregivers, are they trained and licensed? They are trained. I don't know that, and some of them are licensed, others are not. We do employ CHHAs, and sometimes if patients do request, like, oh, I would like a licensed caregiver, then we'll go ahead and try to find one. But sometimes there are limitations in that area, but we do our best to meet the requests of the patient. At best, all of the caregivers that we have on board have 1 year of experience. Any other questions? Okay, well, we'll go ahead and share this slide deck with all of you. After this, we'll also be posting the webinar and the recording on YouTube, just for you guys to reflect back on. Please be on the lookout for emails from us in the future, because we are holding webinars basically every other week, just showcasing our other service lines. So be on the lookout for that. So again, the recording and the future webinar invitations. And thank you all so much.
Thank you so much. This was great.
Great. Thank you. I appreciate that. We'll go ahead and send you the material and a survey after this meeting.